Hi everybody, I'm Dr. Aviva Romm, family physician and integrative doctor with a special background in herbal medicine, here to talk with you today about kids and ear infections, antibiotics or herbal remedies. What can you use? So your little one has an ear infection, a fever, maybe crying, fussy, and you go to the doctor's office or you call the doctor's office and they tell you she has an ear infection and you need an antibiotic. But the question is, do you? How do you know? And if you're going to not use an antibiotic, what can you do to help her feel better? Well, the first question, do you need an antibiotic or how do you know whether you need one, is actually pretty simple because there are great new guidelines that are based on the fact that antibiotics for kids are way overprescribed. So the Academy of Medicine, the American Academy of Pediatrics, and the Centers for Disease Control all agree on some new parameters. Basically, the idea is that for most kids, if left alone with just some simple comfort measures to help them get through the discomfort, they're actually going to clear up their ear infection within a week completely on their own without any negative consequences. So how do you know whether your kid is one of the ones that's going to just clear it on their own or whether an antibiotic is needed? Here are some simple guidelines. If your baby is under 6 months, it's a good idea to go ahead and get a checkout from your pediatrician or family doctor just to make sure everything's okay. For babies who are 6 months, well, for under 6 months, if they don't have what's called a severe ear infection, or for any babies 6 to 24 months with no signs of a severe infection, it's actually okay to take a wait and watch attitude. So how do we define a severe ear infection? Well, this is the same for little kids and big kids alike. A severe ear infection is any time there's a rapid onset of sudden pain, an ear infection or ear pain that lasts longer than 48 hours, or fever over 39 degrees Celsius, which is 102.2 degrees Fahrenheit. In all of those cases, it's actually completely appropriate to use an antibiotic. Does that mean you have to use an antibiotic? No, but that's a good time to discuss it with your child's doctor and see if in your child's case, in that particular circumstance, it would be okay to use some alternative remedies for a day or so and see if things clear on their own. What's really important with treating ear infections naturally or even with just a wait and see attitude is the ability to go ahead and start antibiotics should the ear infection symptoms get worse or not clear up in 48 to 72 hours. If you decide not to use antibiotics or antibiotics are not indicated, there are some great natural things you can do that I've used for 30 years in my practice with my friends and family to help treat kids' symptoms when they have ear infections. The first are just a few simple comfort measures like using a hot water bottle wrapped in a towel, make sure it's not too hot, and let the child lay on that for comfort. Some gentle ear massage where you just take your hands, place them on each side behind your child's ear, and do just some gentle downward stroking, just like this, to help promote drainage of the lymph glands behind there, which can also get swollen and painful. You can use appropriately dosed Tylenol or ibuprofen. They're not my favorite because, first of all, ibuprofen used after even just several days can cause stomach problems, and overdosing on Tylenol can cause liver problems. But even more significantly for me with ear infections is they dampen down the fever. And fever is an important natural process that our body mounts to help us fight infection. So I try not to do anything that's going to lower the fever. But if the natural remedies aren't cutting the mustard quick enough, it's okay to use some Tylenol or ibuprofen, and that's certainly better than using an unnecessary antibiotic. My favorite herbal remedies for kids with ear infections, just to help relieve the pain, are two formulas. One is called Children's Compound or Children's Herbal Compound. That's made by a company called Herb Pharm, H-E-R-B, P-H-A-R-M, and it contains catnip, chamomile, lemon balm, and fennel. It's super relieving for some of the discomforts that come with fever, like tummy ache, and also helps them sleep and relax and reduces pain in a completely gentle and safe way. Another of my favorite remedies is just to make tea out of those same herbs. So you just take an equal part of those 4 herbs that I mentioned, mix them together, and steep 1 tablespoon in about a pint of water just for about 15 minutes, and then you can drain it. How to dose these things is discussed in the blog below this video. Now, one of the best treatments for ear infection that's classic is called garlic mullen earache oil. It's made with common kitchen garlic. It's made with an herb called mullen, and we use the flowers of the mullen. Some of you may actually seen this growing by the roadside in the summer. It's a tall spike with beautiful little yellow flowers growing up it. Very, very common. And that is an excellent pain reliever, while the garlic provides fantastic antimicrobial activity. And this is actually made into an oil, or you can purchase it, and just a few drops are placed in the child's affected ear, so the side that has the infection, and then a hot water bottle or warm towel is placed over it just to help the oil drip into the ear and just to provide some comfort. All the instructions for these are in the blog below this video. In addition to the children's herbal compound and the garlic mullen oil that you use as an earache oil, I also add in elderberry, echinacea, anise seed tincture. Again, the directions for these are in the blog below. This is a fantastic, delicious tasting syrup that helps prevent infection, so it can prevent recurrence, but it also helps break up mucus and promote immunity in the upper respiratory system. So the combination of these three things provides a fantastic natural method for treating ear infections, especially when they're mild to moderate, but even sometimes severe ear infections in older children respond terrifically this way. I hope this video helps you to prevent unnecessary antibiotic use in your kids, provide you with some reassurance that your kids are going to mostly do just fine, just treated naturally for ear infections, and gives you some great tips on 3 simple home remedies that you can easily treat your child with. Thank you for joining me.